Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Deanna, thanks for joining us today on Here for Good, the Inside Edition.
Thank you so much for having me. On behalf of the 160 employees that you have that are sterile processing and equipment technicians, I'm proud to be able to be here to represent them.
I want to start with you. I hear your career path has been very impressive, but it didn't always start out in sterile processing. So take me back a little bit and tell me about your journey.
It actually started out as an EMT. And that is the path that I had started to transition into healthcare. I was given a unique opportunity. I was in my late 20s. I had just been laid off from a purchasing job that really wasn't going anywhere. And I had always had interest in healthcare. My mother started working at Virtua in Mount Holly in 1993. She started as an EVS employee, and she worked her way up to medical billing. And she's still there. Shout out to Nilda Rivera. Hi, Mom.
Hi, Mom.
Hi, Mom. And she always talked very highly of the organization and the opportunities that she was afforded. So it was a place that ever since I was a teenager that I had heard good things about, and I wanted to be part of the community that it worked for. So I started as an EMT. I wanted to get into the hospital in the emergency room, but they were not hiring. I was told try to get my foot in the door and work my way through. There was a position for a sterile processing technician. So I went in there, I shined up, I gussied up my resume, and I went in there and I told them very transparently I had no idea what it was, but that if they were looking for the right candidate, I was their girl.
For some of our viewers, like yourself at that particular time, had no knowledge of what central sterile processing was. Could you describe, maybe in simple terms?
We are responsible to prevent the cross-contamination from what one patient deposits from reaching another patient, right? For reusable surgical instrumentation and all equipment. Everything that is reusable comes through our department, through our technicians who are responsible for inspecting, cleaning, storage, disinfection, sterilization, and distribution.
So you manage about 28 techs. What is something in their day-to-day work that would surprise most people?
The technicians, in addition to being educated, having to know tens of thousands of different instruments across all kinds of lines, right? Having to know how to handle them properly, sterilize or disinfect them properly. That is the mental acuity, the education, biological test, legal sterilization records, quality control testing on all the machines and that documentation. In addition to the physicalness of having to move, distribute all of these individual trays, pieces of equipment, decontaminated to the decontamination through the process, back out to the end user. It is a lot of mental, it is a lot of physical, and it is nonstop. And these technicians show up every day for the patients, take so much pride in their work so hard. The volume I see them put out every day, it is really impressive.
And when you add to that the complexity of the instruments that we use today has evolved tremendously, and how we take care of them. Tell me a little bit about that evolution process in sterilization. I mean, at one time, I think all of the instruments were just, you steamed them.
There was a time where it was a lot simple. It was more simple to inspect an instrument, to ensure it was clean, to ensure that it worked properly, and to sterilize it with steam. During the 1980s into the 90s into the 2000s, when minimally invasive surgery really started to come in and really started to take off and people became more comfortable with it, also came the evolution of the medical devices. So as in the beginning where you had simple devices, which are still used and are still are standbys, maybe 10 steps from decontamination to the sterile storage. Now you're working with very complex instruments, Wi-Fi capability, 3D printed endoscopes with over 100 individual steps from pre-cleaning to sterile storage.
Not just that, the materials have changed in which the
Yes.
instruments are made of.
And they
correct?
can't handle that steam anymore. So now we're using other methods of sterilization, low temperature methods, more complex. We are running biological testing every day on every load. That is a best practice done at Virtua. And there is a lot of education that the technicians take on themselves to continue their education, seminars and different webinars and in-services that we provide to make sure that we are providing the optimal quality for the people. And you said it at the manager meeting I was at last week. We take care of the people who take care of the patients.
How does the individuals in your department still remain focused on quality, safety, experience when they don't
Yeah.
really have that interaction with the patient?
My technicians are educated. They are at the top of their game. They keep up with the latest trends, the latest regulations, the latest standards, and they're empowered through leadership. I'm empowered from my leaders. I'm able to empower my technicians to make critical decisions. They understand they are patient advocates too. They are intricate parts of the patient care chain, and what they do or what they don't do affects the patient. And I let them know every time a baby is born, every time a surgery is done, every time they rang that bell during COVID, we took a piece of that.
You're not only now leading your team, I know that you're also committed to the education and training of the next generation.
This opportunity presented itself to me in 2023. I was called by Rowan. The long-term educator there was retiring, and they were looking for another educator. I thought at first it would just be the young and the interested. I have the young. I have people coming that just want a career. I have people coming out of retirement. Rowan also works with the Return to Work program for people that have been out of work that don't have career paths. And we bring them in and they learn and they are able to get their certifications and start careers that they can take pride in. I've had the opportunity now to do clinical training for students that I've brought through, and then they come to Virtua and they do clinical training with me, and then they get jobs and they call me. They email me years later, hey, I passed this test, or I just got my first job, and it's such great validation.
And I guess my final question, clearly you have such passion for the work that you do and your commitment to Virtua. You have a demanding and important job, but balance is also important. How do you maintain that?
I've been doing this a long time, and I will say that my professional journey has been carried by my personal one. My personal journey has been just as important. And as I mature and I get more involved with the community and I advance in positions, it's important for me to have a place where I can recharge. And as people count their steps, I say, as you can tell, I count my words. Sometimes I say so many words in a day and in a week. So when I'm done, my home, I recently purchased a home, and it is lovely, and I have a lot of animals. My animals are my passion as well.
A
So I
lot
have
of animals. Give me an example.
well, it's not a farm as much as I wish it could be. So right now, 2 dogs,
Uh-huh.
2
That's not a lot.
rabbits.
Oh, okay.
I also have 2 very large aquariums. I would call them fish tanks, but they're aquariums. We also have chickens, and we have ducks, and I have a canary winged PB.
Let's go back to the chickens and ducks. Pets?
Pets, yes, yes.
Okay.
Well, yes, no, they are my pets. They are not dinner.
The chickens. Do they have names?
Well, some of them do, but we are funny with our names, right? So it's it's like
Chicken one, chicken two?
it's like filet nugget, like, chicken fry. For me, what it is it's the simplicity of nature. I'm a city girl. I was brought up a city girl. So again, all these opportunities, to be a sterile processing technician, to be a manager, to be a teacher, and now to be able to have a home and have chickens and animals are all things that a young city girl once never imagined for herself. So I'm so blessed and honored to have been able to have these opportunities and now to help others to hopefully, reach their career paths.
Thank you so much for sharing your journey with us and really exposing the rest of our colleagues to what I would consider an unseen, not always front and center, body of work that's done by you and your other colleagues.
Thank you for having us and for recognizing sterile processing and equipment technicians across the virtual organization. They work so hard, and I appreciate every one of them. Thank you, sir.
This has been a great opportunity to hear more about a part of our organization that is not always front and center for a lot of folks. And it was a great discussion. And I hope you tune in next time for our next episode of Here for Good, the Inside Edition.